Hi, good morning friends. So today I am here to answer questions which you've been asking me since I've started working on autoimmune diseases with vitamin D and Coimbra's protocol. So let's try and understand what is this. Vitamin D is not only a nutrient, right? It is an immunomodulator and a very intelligent one. I'm sure we all know that our body is the most intelligent machine that has ever been created, and no mankind machine can match with the intelligence of this human body. Likewise, vitamin D is also a very, very intelligent molecule. It acts as a nutrient, it acts as a hormone, it acts as an immunomodulator at the cellular level, depending on the requirement of our body. Why do we say this? We all know autoimmune diseases are diseases where our immunity gets misfired. Now let's understand, during COVID times, we all know what immunity is. You can have proper immunity, you can have weak immunity, you can have active immunity like when you are pregnant, or in situations like that, like females have more active immunity, strong immunity than men. And you can have misfired immunity. Now what is misfired immunity is that your own body and your own immune system and your own defense army starts to act against your own body parts, thinking they are outsiders invading your body. Outsiders invading your body. And suddenly what happens? The body starts releasing antibodies and autoimmune reaction starts in the body, leading to autoimmune diseases. There are more than 80 plus autoimmune diseases we know of today. And the most common ones of those are type 1 diabetes, rheumatoid arthritis, Hashimoto's thyroiditis, multiple sclerosis, irritable bowel syndrome, Crohn's disease, and we can go on and on. But let's look at the fact that does all these autoimmune diseases need separate medications, or do these autoimmune diseases can be treated with one core philosophy of working on the root cause of these diseases? So friends, in allopathy, I'm an allopathic doctor, 1989 batch, Amritsar Medical College, and have been seeing allopathy helping lots of patients through these years. But when it comes to lifestyle diseases, such as diabetes, autoimmunity, hormone imbalances, somehow we need to work with a different approach. We need to work on the cause of the disease at the cellular level. So at the cellular level, for all these 80 autoimmune diseases, the cause is same. And very important causes, vitamin D either is deficient or vitamin D receptor gene has polymorphisms, heterozygous or homozygous, where our body is not able to use vitamin D to modulate the immune system of our body. In both these cases, if we are deficient, so a lot of patients come to me with vitamin levels of 3, 5, 15, 20, and they think it is okay, it's just one deficiency. But no, friends, it is a deficiency by which your body is not able to work at all. Your cells do not get the required energy or the fuel to work. And that is where we start getting diseases, especially diseases like autoimmune diseases, which stay with us for life till we work on the cellular level. Use of anti-inflammatory drugs, steroids, and other medicines which in allopathy we use only take care of the symptoms. And the disease keeps progressing on and on and on. Now in this situation, Dr. Coimbra has been working on patients of multiple sclerosis, which is an autoimmune disease of the brain. And I have been trained by Dr. Renu Madhani, who was trained by Dr. Coimbra, to work on autoimmunity through this protocol, which means we correct the deficiency of vitamin D, one. Second, we give high doses of vitamin D because we know that these patients have vitamin D receptor gene polymorphisms. Now, what is it that we have to be careful of when we do high dose vitamin D therapy? A lot of you ask me, vitamin D, what are the side effects? So friends, what is important is not understanding what are the side effects of vitamin D, which I will cover in one of my other videos. But what I want to talk to you today is about the relationship between vitamin D, parathyroid hormone, and calcium. Because this triangle is important for us to understand to have a good immune system and to work at the cellular level of vitamin D. So what happens? Vitamin D and ionized calcium and parathyroid hormone, they are like seesaw, right? So if your parathyroid hormone is high, your vitamin D is low, your parathyroid hormone becomes high. The moment you increase your vitamin D like this, your parathyroid hormone comes low. Parathyroid hormone has a wide range from 15 to 65. So even if patients have vitamin D of 140, but their parathyroid hormone is 22 or 25, we still have scope of increasing the dose of vitamin D, but depending on what are the symptoms of the patient. If the symptoms are improving, I will stick to this vitamin D dose which we are getting here. But if the symptoms are not improving, I have scope to further increase the vitamin D. Now, what Dr. Renu has taught us, and I have seen in my practice also, is that in Indians, we don't have to use very high doses like Dr. Coimbra uses of 1 lakh, 1.5 lakh units of vitamin D. We are able to give very good relief with 30,000, 40,000 IU of vitamin D to patients. But important to note here is that we have to give them daily dose. Why? Because in fat cells, vitamin D stores for about 15 days. And therefore, weekly and fortnightly supplementation to take care of your deficiencies is all right. But when we are working on autoimmunity at cellular level, the cellular life of vitamin D is only 24 hours. So it's very important that we give vitamin D daily in such cases. Also to note here is, when parathyroid hormone and vitamin D are being noted, we have to look at side effects which happen because of ionized calcium and not because of high dose of vitamin D. Now, what is to be noted here is, when your calcium levels are low in the body, the PTH increases. And what is the role of PTH? It brings out calcium out of the bones because body knows how to keep calcium levels in balance in the blood, which is very, very important for our normal functioning. Like I said, we have a very intelligent body. So our bone health goes down, and you would know that osteoporosis is increasing dramatically these days. Our bone health, despite having enough calcium in our diet, is going for a toss, or we are becoming osteopenic or osteoporotic, and we have to take care of that. Now, coming back to this calcium. So parathyroid hormone will take out calcium. So low calcium also increases parathyroid hormone, right? Few other factors which we have to take care here are magnesium. Magnesium keeps the vitamin D fluid, and therefore it is very important that good magnesium levels are maintained in our body. Also, K2 is very important. Why? Because when calcium levels increase, right, it can get deposited either in the bones or in our arteries. Where do we want it deposited? In the bones, not in the arteries, because that will lead to heart problems. And to avoid that, we give K2. Now, initially, we did not have K2 available in India, but now some very good brands are available, and we are able to give you good quality K2 so that complications can be avoided and bone health can be maintained. So, this is also important. And last but not the least, calcium. Friends, when we are doing these therapies, we generally have low calcium diets. In Indians, we don't have to worry too much about that. The only thing we have to take care of is that we do not give you extra calcium supplements. We try to give you enough calcium through diet. And our diet has enough calcium. So you don't have to worry about calcium. What you have to worry about is getting that calcium to the right organs, to the right place. One very important point here to note is our immune system is not in one part of the body. It is everywhere. But 70 to 80% of our immune system is in our gut. And that is the reason gut health becomes very important. Most of the patients of autoimmune disease, they start with some gut infection, some gut symptoms like bloating, constipation, diarrhea, loose motions, not able to digest food. And it is very, very important that we take action at that point to avoid getting into the circle of autoimmune diseases, right? And for that, we do elimination diet. We remove all the bad parasites, bacteria, fungi. We clean the gut, and we use the RRR protocol to heal the gut with this vitamin D Coimbra protocol to get you out of autoimmune diseases. This is not all. One very important thing you all have to remember is exercise. Exercise helps us use the minerals and vitamins at the right place, at the right organ, and build strong bones, right? So don't forget to exercise for 30 minutes, and do share this video if you know anybody who has any gut problems or autoimmune disease problems. Do share it with people who are struggling to find solution and don't know how to come out of that symptom-based methodology to working at the cellular level. And you would have all realized this is very scientific. You will find a lot of data on PubMed, on Google Scholar, where studies have shown that vitamin D has helped step up the immune modulation process in type 1 diabetic patients, in multiple sclerosis patients, in irritable bowel syndrome patients, in rheumatoid arthritis, psoriasis, vitiligo, irritable bowel syndrome, and I can go on and on. So friends, trust me, this is going to change your life if you have autoimmune disease. Do share, do connect with any Coimbra protocol practitioner and heal yourself from autoimmune diseases. And remember, if you start working early, you can reverse autoimmune disease. But if you think this will go away on its own, it will only keep on adding every few years one more disease. Choice is yours, and make a choice right now to heal yourself, to reverse yourself, and to live a healthy life. Thank you. This is Dr. Preeti Nanda Sibbal. I practice functional medicine at Gurgaon. I'm a fellowship holder from A4M and an MBBS doctor from Amritsar Medical College. Happy to help you, happy to heal.